Hi, welcome to Keto Life Support, where we make your keto life sustainable, fun, and low stress. I'm Kim Howerton from theketonis.com, and I'll be coming to you weekly with some of my keto besties to bring you the practical, real-world keto advice that you need. Quick disclaimer, I am not a doctor, and even if we have a doctor in the house, he or she is not your doctor, and nothing on this show should be taken as medical advice. Always check with a trusted medical professional about your personal medical concerns. Hello, Dr. Bear.
Hi. You like my halo?
Hi. I do. You're like, it's like you're anointed.
That's weirded me out a little bit. Let me move. That's too much, even for me.
Is that new?
Yeah.
Is that a new
Nisha moved my studio around when I was at work one day, and I came home. I'm like, okay, moon. Yeah, got it.
All right. Yeah, sounds good. Yeah. So I just, I'll say this. I texted Dr. Kent. I said, I'm not looking forward to looking like hot garbage on the air, but that's the reality. So, we just had the holidays, and Dr. Bear, I don't know if this happens to you, but my face is like the example. I cannot get away with anything because I had some dairy and I have puffy eyes. Now, it also doesn't help that I'm still fighting off the cold that wants to come back, but I get jowls and my eyes disappear. So
yeah, your face tells on you. Your significant other would look at you and be like, "What have you been eating? What did you eat?"
I know, but it's so amazing how, even being 100% keto, it's just not enough. Like we are so ingredient specific. Some of us.
Yep. And it's not everybody, but some people it absolutely matters, and it's a big deal.
Yeah. It's funny because I have zero digestive issues from dairy. A lot of people, their telling signs they don't do well on dairy is that they get a stomach ache. And I kind of almost wish that I did, because I feel like that would be more motivating, because what happens is I'll do it and then I'll be like, oh no, I have to do a live today and everyone's going to see my face.
Yeah, that's okay. Back to carnivore.
I made some short ribs yesterday.
Yeah, that's nice. We bought some rib tips. I think that's what it was called. Beef rib tips. And it was just like this much of the rib out at the cartilage.
Okay.
Dude, they were amazing. We made them, put them in the Instapot, which you've got one, right? Mm-hmm. I don't even know how we live without that thing. We use that thing every day.
It's great. I go through fits and starts. Like I'll pull it out and use it all the time, and then I'll stop, and then I'll start.
Right.
People want to know how's the muscle building.
So it's going great so far. I haven't hurt myself, and so Nisha's still on board because that was one of her requirements. If you hurt yourself, I'll kill you. And so I'm currently doing. I started on my birthday, December the 9th. I turned 50. For those of you guys who don't know. And so I thought, I'm keto and now carnivore, and everybody says, oh, you'll lose muscle on keto. You'll lose muscle. You can't put on muscle. And I thought, I think it'd be a great story if me at 50, who I didn't work out at all. And I've always just kind of held some muscle, but I didn't work out. I'm going to start working out, and I'm going to see just what I can do in a year's time. And I've got some great coaches. I've got Robert Sykes, who's on Instagram and Facebook as Keto Savage. I've got Danny Vega, who's, Keto Evangelist?
No, well, he works with Keto Evangelist, but he's a Fat Fueled Family. Right.
And then Jason Whitrock, who's definitely on Instagram, maybe Facebook too. But those guys are all strictly keto, and they are swole. I mean, they are jacked up with muscle, and so they're kind of tutoring me along. And so what I'm going to do, Kim, is I'm going to post pictures on the 9th of each month, unless my ADD kicks in. So basically once a month, I'm going to post update pictures like, okay, here I am now. Can you tell a difference? And we'll see what 12 months of working out does on keto and carnivore now.
Nice.
Yeah.
Nice. Yeah. Awesome. That's great. let's see. So I think Dr. Bear and I are going to just chat about a topic for a little while, and then we'll come through and look at questions.
And this is a very important topic.
Hold your questions.
Very important topic. And if any of you guys listening, if you know someone who's on an antidepressant, you need to yell at them right now. Text them, message them, call them, go grab them by the hair. They need to hear this, because I would venture to guess, Kim, that 95% of people who are on an antidepressant have not had the lab work tested. That is absolutely mandatory. You have to test these things before you diagnose somebody with depression. If somebody comes in your office as a doctor and they're just down in the dumps and you say, oh, here's some Prozac, completely inappropriate. Not good practice at all, completely inappropriate, because there are so many medical conditions that mimic the symptoms of depression. And I've had patients come to me and say, yeah, I was on Cymbalta for 10 years and finally they figured out I had low thyroid. That's just one of many examples. And so we're going to talk about the different conditions, medical conditions that can mimic depression symptoms. And the test that you should, so if your doctor says, hey, I think you have depression, I'm going to put you on fill in the blank. You need to say, hey, aren't you supposed to check some lab work first before you diagnose with depression? And he'll go, oh yeah, we'll check some labs today, because that's completely inappropriate.
Yeah. I mean, so I had depression issues starting from the time I was 9 years old. So really, really young. And they do run in my family to have depression issues. And so, everyone just assumed I had depression issues. And, then throughout the years, I was given all sorts of antidepressants. None of which, and this is actually a really probably key detail, none of which helped. None of the antidepressants had a positive effect on my depression issues. My favorite was the one that I gained 40 pounds in like 2 months. Was
that Effexor or Lexapro?
I think it was Lexapro.
Yeah, those are the two worst.
Anyway, I blocked it out. But and then they're like, well, we don't think you have depression. We think you must have bipolar, right? If these medications are not fixing your depression issues, well, you must be bipolar, because sometimes you feel okay and sometimes you feel awful. So that's bipolar. And
you're right. And it's not even funny, but it's true.
It took a good, I laugh so I don't cry, it took a good 20 years for them to finally find a doctor that said, you have thyroid problems. And now I will say I still have depression issues. Like, it's not 100% one thing all the time. But if my thyroid is medicated, my depression is 90% improved. Like, that little bit remaining might just be that I'm a little moody. But if I don't manage my thyroid, I will fall into a deep depression again.
Absolutely.
So that's just my story. But 20 years, Dr.
20 years that you suffered because your doctor didn't do his job. And this is not even my opinion. If there are any family physicians or internists watching, go look it up. Go back to the textbook and read about depression. And it says plainly, part of the workup prior to diagnosing someone with clinical depression is to rule out the following things. The diagnosis of depression is a diagnosis of exclusion, just like fibromyalgia. Somebody don't walk in and say, oh, I'm achy, and they're like, oh, you got fibromyalgia. Ignorant doctor if somebody does that. This is where you check this panel of tests. It comes back normal. You check the next panel. It comes back normal. Then finally you're like, well, I've ruled out everything, so it must be depression or fibromyalgia. That's how those two things are diagnosed. And there are other things that are diagnosed that way too. But the psychiatrists are the worst in the world. You go see them, tell them you're down in the dumps, you're going to leave on an antidepressant. And 99 out of 100 of those guys, they ain't going to check no labs. Right? It's malpractice. I'm sorry, but there's just, it's in all the textbooks. It's in all the journal articles about depression. You do not diagnose depression until you've ruled out medical conditions that can mimic depression. This is med school 101.
Right. There's Dr. Ann Childers and Dr. Georgia Eid are two psychiatrists who are on the other end of the spectrum in terms of really understanding the connection with mental health and food. And so, there are good psychiatrists out there, but you do have to, just like with across the board, you have to really be your own advocate and know what a good doctor looks like to know when you're in front of a bad one.
But the part about this that infuriates me is this is not the patient's job to know. But these days you kind of do have to know. It's not your job to know, oh, wait, doctor, shouldn't you check my thyroid function before you shouldn't have to know that.
Right.
But more and more patients are having to know that kind of stuff, and they're having to print off, the American Academy of Family Physician journal articles and take to their family physician and say, well, this says you should check all these things to make sure it's not a medical condition. That's not the patient's job. And that really triggers me just a little bit that doctors, because this is not even something that's not 100% agreed on. This is not like keto versus vegetarian.
This is settled science.
You do this or you suck as a provider. That's just basically how to sum that up right there. And so let's talk about some of the medical conditions that can mimic depression and the tests that you would check for that to rule that out. And so Kim's already brought up the first one, which is probably the most common, especially in women. It's going to be the most common, and that is hypothyroidism or thyroiditis. So either an autoimmune thyroid condition or just hypo or low thyroid. And so you're going to ask your doctor to check a full thyroid panel in order to diagnose all those things. And even severe hyperthyroidism it usually causes anxiety, but it can also cause depression as well. So really any thyroid abnormality can lead to at least some of the symptoms of depression. Okay. And so you need a full thyroid panel drawn. And I don't know if Kim's got this anywhere on her page, but there's a website called Stop the Thyroid Madness, and they have the full thyroid panel that you can copy down and take to your doctor. If you're currently taking an antidepressant and you don't remember having any blood drawn, you definitely need to have your thyroid checked ASAP.
Yeah. It's interesting. When I finally got to a doctor that was really knowledgeable about this, she explained that a lot of people with Hashimoto's specifically get diagnosed as bipolar because the swings of hormones in Hashimoto's, because what'll often happen in Hashis is you won't just have lows, you'll have like alternating lows and highs, at least initially, can mimic the symptoms of bipolar. And so it's really interesting to see that link as well.
Yeah, and people can wind up on powerful medicines like lithium and Zyprexa for their bipolar and unstable mood when it's just Hashimoto's thyroiditis, which is diagnosed with a simple blood test. And so that's probably the most common is the thyroid conditions that can mimic depression. And so that's absolutely vital if you're on an antidepressant or you are down in the dumps all the time. You got to have your thyroid checked. That's number one. Number two, I'll just go down through the list, Kim. The next is, and so you kind of touched on Hashimoto's. It's an autoimmune. There's a lot of inflammation, and that can lead to depression symptoms. Any inflammatory condition really in your body, whether it's an irritable bowel type thing, any of the hundreds of different types of that. So a high sensitivity CRP, that's a great test to check. It doesn't really tell you what it is, but it tells you that something is there. Having just depression is not going to raise your CRP. And so if you have an elevated CRP and depression symptoms, you've got inflammation somewhere, and you can work on that with your diet, with fasting, with that sort of thing. But that's a great kind of catch-all test to just see if there's any inflammation anywhere. And so that's one that's on my depression list if somebody comes in with depression symptoms.
Yeah, absolutely. I think that's very important. And there is actually research about the inflammation and depression being linked a lot.
And actually, I predict, Kim, over the next 5 years, there's going to be studies that were done that were shelved because they showed that there was inflammation played a large part in depression and anxiety, but you can't really make a pill for that.
Yeah.
And so the big pharma company that sponsored those studies are like, we can't make any money off this. We're not going to publish it. Guarantee you, watch over the next 5 to 10 years as we find more and more of these studies that just never got published because they'll say they were inconclusive, but what they really showed was some valid physiological reason for the symptoms. Inconclusive. That's right. Exactly.
Which means I don't
like the results. So we're going to put it in the attic or the basement and hopefully nobody finds it. Yeah. Another great one that a lot of people don't even think of. I've had people with severe depression symptoms and it was all because of low vitamin D. I've seen that multiple times.
Yes.
Big deal. And it's usually with people with very low vitamin Ds, like 8 or 10 or 15 or something. They can get moody and down in the dumps with a super low vitamin D like that. And so vitamin D is a simple blood test. You can check it and you want to get your vitamin D 25 checked, not the vitamin D 125. And so you shouldn't have to know that, but you might, if your doctor hasn't checked labs for your depression, you may need to write that down. And so, but that's a big deal. Vitamin D helps you in hundreds of ways. One of the things it does is heighten your mood, improves your mood.
All right. So we got thyroid.
Are you keeping up with these?
We got inflammation. I am. Thyroid, inflammation. We got vitamin D issues.
Yep.
Next on your list?
Vitamin D is in dog, right? And so another one.
D.
Another one is vitamin B12 deficiency. B is in boy. That's right. B12. And if you're very low in vitamin B12, you can have not only depression symptoms, but you can even have symptoms of dementia or even psychosis if your B12 is low enough. And a lot of people who don't have intrinsic factor, if they've had gut surgery or they just for whatever reason don't have that, they can't absorb whatever little bit of vitamin B12 they eat in their diet. And so then also some people have the MTHFR gene, which we'll get to in a minute, and they can't use the vitamin B because it's not methylated. And so, a lot of times it's vitamin B. Again, that's a very simple blood test. You need a B12 level checked. You need a folate level, and you need a homocysteine level, right? And those are going to give you the full picture of your vitamin B12 status. I've had one or two people who had very low vitamin B12 and they'd had gastric bypass surgery and they had either forgotten that you got to take B12 the rest of your life, or they just hadn't been doing it. And they were really down in the dumps and it responded immediately to B12 supplementation.
All right. Now, is that B6?
Yeah, B6. Right.
And
those are also, if you're drinking too much alcohol, those are the two vitamins that are going to get depleted very quickly. And so alcoholism can mimic depression for all the world. If they don't volunteer to you, hey, I drank 2 6-packs every night. Yeah. And so part of the reason it leads to that depression is not only the psychosocial problems that it causes in your life, but it depletes your B12 levels. And so that can really give you severe.
It can be kind of a cycle.
Exactly right. And then you feel like crap, so you drink more, then blah, 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 blah. Exactly. Yeah. Yeah. But a B12 level needs to absolutely be checked if you've been diagnosed with depression. The next is a group of tests, and it is the gender hormones. Okay. I can't even begin to estimate the hundreds of men and women who are going through either menopause or menopause and come in and they're like, I don't know. My wife says I'm depressed. I sit in the chair all day. I don't want to do anything. I sleep all the time. I don't care about having sex. I don't care about finishing hobbies or projects. I just don't care about nothing. And an uninformed doctor is going to say, oh, it sounds like you're depressed. Right? But a smart doctor is going to say, you know what? You're a 56-year-old man. Let's check your testosterone level, right? And I've seen so many hundreds of men, their testosterone comes back 100 or 200 when it really needs to be 600, 700, or 800. And that's why they're depressed, is because they've effectively been neutered, right? And so when we optimize their testosterone, this guy who had depression is suddenly his wife can't find him because he's not in the recliner anymore. He's outside doing whatever it is he's doing, and he feels great again. He's got plenty of energy. He only sleeps at bedtime. And so magically his depression was cured by giving him some testosterone, but it's really he had testosterone deficiency. The same goes for women who are going through menopause. Testosterone as well for women, you check that, but also estradiol and progesterone. All three of those you check in the woman because they can have any combination of deficiencies, and they can all lead to either anxiety symptoms or depression symptoms, which I've had many a woman in her 60s come in on Paxil or Prozac or Zoloft because her doctor thought it was depression. And it was really, she just had low progesterone and low testosterone. Yep. Yeah. Sad but true. And so for me, and you'll check that. Go ahead.
I was going to say, and one of the really insidious cycles when you either get diagnosed with depression issues, by the way, neither one of us are saying that depression issues don't exist in and of themselves.
That's right.
We will clarify. But one of the insidious factors when you get diagnosed with depression issues, everything gets blamed on the depression issues, and it can become a vicious cycle. Right. Because you feel bad, so you think, it's just, you feel bad, you think bad things, everything feels run down, you're tired, you're exhausted, nothing seems worth it. And then you basically just keep talking yourself into a corner, and your meds aren't helping because they're not the meds you need.
Right. And it's your doctor's job to think of all these things. That's your doctor's job. And so if they're not doing that, then you need to change your doctor or change your doctor. Okay. The next one, Kim Howerton, is magnesium. Very commonly, low magnesium can lead to just down in the dumps. And insomnia is one of the symptoms of depression, right? If you have severe insomnia, there's a checklist of things. And if you have so many of those on the checklist, then you're diagnosed formally with depression. Well, if you're down the dumps all the time, you're irritable all the time, and you have insomnia every night, that's three of the things on the checklist, right? And so a lot of doctors jump the gun, lazy doctors, and say, it must be depression. Here you go. And really what you need is more magnesium. And so magnesium is a very simple test to check. If you're on the low end of normal, not even below normal, but just on the low end of normal, you probably need a magnesium supplement because there's just not much magnesium in the standard American diet at all.
Right. Do you have a specific, a lot of people will ask, like, should I be taking a glycinate or a malate or a citrate? I usually tell them if you're having bathroom problems, stick with a citrate, but otherwise maybe a malate or a glycinate. Do you have an opinion?
Well, I used to really caution people, like, unless you have severe constipation, don't take mag citrate. But I take it every day now, and so does Nisha, and I have tons of patients who love the drops, the Mega Mag, and that's magnesium citrate. And I have not had anybody, maybe one person out of 100 says, it gave me diarrhea. And so, but if you get diarrhea from magnesium citrate, which is the most common one, then you can switch to magnesium malate or magnesium glycinate. They have fewer bathroom issues. If your doctor gives you magnesium, it's almost certainly going to be magnesium oxide, which is the worst absorbed of all the magnesiums. It's not bad for you or dangerous. You're just going to poop it out. You're not going to absorb it. And so it's not going to help you. And so if your doctor writes you a prescription for magnesium, that is magnesium oxide, don't even fill that. Again, you're going to have to be smarter than your doctor and get some mag citrate or mag glycinate.
Yeah, I read that mag oxide, when you look at it in isolation, looks like a better drug, but when you put it in a person, not so much. Exactly. So it's another one of those things where you have to actually address the human sphere in front of you, not just what does this do on paper.
Right. Oh, the patient. Yeah. Oh, yeah, that person.
Yeah. Oh, right.
Yeah, exactly. Okay. And so going down through the list, the next one would be homocysteine. So homocysteine, if it can be a sign of inflammation, but it can also, remember I said it earlier in conjunction with the B12. You can have a normal B12 level, but if your homocysteine level's high, you can have B12 deficiency, and that's the picture. And so you check a B12. I almost never check a B12 without a homocysteine because it gives you the full picture. And so you have to check a homocysteine to ensure that there's not a masked or hidden B12 deficiency. Another one that's very common is zinc deficiency. And I don't routinely check zinc levels. I do, but not on every patient with depression. But anybody that, well, one of the things zinc does is it helps to raise your testosterone level because it pushes it away from the estrogen pathway back to the testosterone pathway. And so again, if you have low T and that's the cause of your depression, then the zinc is going to help to correct that. And then zinc also helps you in hundreds of other ways as well. But a severe zinc deficiency can mimic depression, and that's in the textbooks.
Okay. Yeah. And then I cannot hear about zinc without thinking about Dr. Georgia Eads' presentation about that if you eat a whole wheat tortilla with your high in zinc oysters, I think it's oysters, you will get zero or basically close to zero of that
That's
zinc
right.
because the whole wheat tortilla will steal all of the zinc away from your bioavailability.
That's right. And for those of you watching who are not eating keto right now, you're maybe just feeling around. One of the reasons that we say stop all grains is because grains are disaster when it comes to causing malabsorption of vitamins and minerals. Okay. And so it's almost like grains are anti-nutrients. And zinc is one of the many examples. If you're eating whole grain bread or tortillas or whatever, or corn for some people, you just won't absorb the zinc. And so you can eat all the zinc in the world and you won't absorb it. You'll poop it out because of the gluten and the other little proteins in the grains. You just won't absorb the nutrients. Yeah, exactly right. Very good point. Yeah. Another great thing, and this is actually, you've heard of celiac, and we're talking about gluten.
Yes.
And so celiacs can have severe depression, and it's called, I don't even know if we know exactly why. It could be the inflammation, could be some byproduct, but they can have severe depression, and it immediately responds to getting the grains out of their diets. And so a celiac panel, if there's any doubt about that at all, is also a great thing to check if you think somebody has a medical reason to be depressed.
Yeah, absolutely. I would imagine that I can't imagine that the inflammation doesn't have something to do with it, but all of these things can be very multifactorial. Like it's usually not just one thing, but it's often kind of a cascade of things, I find.
Exactly. And again, let me repeat again what you said earlier. We're not saying that depression doesn't exist. We're not saying that clinical depression is not a thing. It is a thing, but many times it's misdiagnosed. You're diagnosed with depression when what you really have is a low thyroid or low testosterone or low progesterone or low zinc or low magnesium. And so if you're going to be diagnosed with depression, I want it to be a real and meaningful diagnosis, because then you'll probably respond to the antidepressant, right? But if you don't truly have depression, if you have something else masquerading as depression, then obviously the antidepressant's not going to help you at all.
Right.
Yeah.
Right.
Now, the next one, we have a good friend who has this problem, and that is the MTHFR gene mutation.
Yeah.
And so this does many things to the human being. One of the things we know it does is that they cannot assimilate unmethylated B vitamins, right? And so if the B vitamins aren't methylated, they can take all the B12 in every 10 pills a day. It's not going to help their mood and help their other symptoms. And so you can get your MTHFR gene checked at your doctor's office. Your doctor may have never heard of it before, but that's okay. Sometimes patients have to educate their doctor. That's okay. And so you can print out some stuff about the MTHFR gene and take it to him and say, hey, I wonder if this is the reason I have symptoms of depression. And then he can look it up and then he can check it. And if you have it, you'll know to start taking methylated B vitamins. And for some people, we have a mutual friend who it's night and day if she's taking her methylated B12 versus before she knew that she had an MTHFR gene mutation.
Right. And because of that, a lot of people with MTHFR issues are diagnosed as having multiple depression issues.
Exactly.
Yeah, absolutely.
And I'm assuming that your doctor is going to check all the routine labs, but since that's not always the case, let me talk about a few more. A low sodium level can make you depressed, delirious, even demented. And especially in older people, if your mom all of a sudden just starts going down, like, I don't know, mom, something's wrong with mom. She's not thinking straight. She's down in the dumps. She keeps more forgetful than ever. It could be low sodium. And if someone's taking a blood pressure medication, then that can mess with your sodium. And a lot of times elderly people you'll think it's severe depression or severe dementia. And you check the labs, it's just low sodium, and it's easily correctable. And then you've got your mom back 100% just like she was before it started. And so a complete metabolic panel to check for all the electrolytes, sodium being one of those. Another thing is to check the liver, because if you have severe cirrhosis and you don't know it, you can build up ammonia in your system, and it can make you have dementia symptoms or depression symptoms. Zoloft's not going to help that. You got to diagnose that, and you diagnose that with lab work. Another one is if you have severe anemia, your brain's just not getting the oxygen that it needs. And that can masquerade as several different ways. I mean, you might have the classic, pallor and pale tongue and all that, but you might not. Depending on your skin tone, the only way you may manifest with severe anemia is just being depressed, no energy, down in the dumps. All three are symptoms of depression, right? And so by a lazy doctor, that could be misdiagnosed, and it's just severe anemia.
Got it. Yeah. Well, that's important, because and there are a lot of people who are walking around, I think, with borderline anemia.
Absolutely.
Like, I cannot get my this is due to gut issues, is really my strong theory, but I walk around, the only time that I have sufficient amounts of iron is when I'm fully carnivore, which means I have to eat way more red meat than the average bear to have normal iron levels. And so I do think that, a couple people have commented about the gut brain barrier, or not barrier, connection.
Right.
That's what I meant to say. And that those of us with gut issues often can seem to have depression issues or experience depression. I mean, depression is a thing, and it's subjective in a lot of ways. So, whether you say seem to or have depression, but what is at the root of it, gut, which might then be the malabsorption. It might be the inflammation, but there's definitely a connection between gut issues.
Absolutely.
And depression issues.
Absolutely. And so the problem with depression is there's not really a lab test for depression. And and honestly, all jokes aside, that's why most doctors don't think to check labs if you have signs of depression. They'll say, well, dummy, there's no test for depression. What do you want me to test for? And they forgot all of their internal medicine training that other things can masquerade as that. Okay. And two other rare things that are in the textbook that can masquerade as depression are undiagnosed HIV and undiagnosed syphilis. When it goes into its third stage, if it just hasn't been diagnosed, you can have severe depression, psychosis with both of those. And if you're not, if your doc's just not checking any lab work, you're not going to know about any of these things that we're talking about. And so you're going to wind up taking 1, 2, 3, 4 different psych meds, and it's not even a psych issue. You've got this, that, or the other, or some combination. Or you've got mild depression, which could easily be treated if you would just fix the thyroid and the testosterone or whatever. This medicine stuff's kind of complicated. A lot of doctors try to simplify it, but if you're doing your job properly, you got to think about a lot of stuff for each and every patient.
Absolutely. And I mean, we know there's also, right, Amber O'Hearn's story.
Yes.
Which is that she had pretty debilitating bipolar disorder until she went carnivore. And getting to the root of why that helped, there's mostly a lot of experimenting and guessing, but you can't really negate her experience that not only what did she potentially have a problem that she couldn't fix without changing her diet, but that changing her diet, essentially brought her symptoms to zero.
Exactly. And that's another huge point, is that for many people, It's your diet. That's why you're down in the dumps. That's why you're depressed. That's why you're inflamed. And so that's why Kim and I are always harping on, you need to eat keto, if not carnivore, because that's going to lower the inflammation. That's going to lower the insulin. That's going to lower all the things that can lead to the signs and symptoms of depression.
Right. Absolutely. So it's, and I often say this, like, you might have a ton of symptoms of things, but until you clean up your diet, you can't really get a lay of the land.
That's right.
It's like you're just pouring tar on your life. You can't see what's actually happening. Right. But you clean up your diet, you go keto. Not everyone needs to go carnivore, absolutely. You go keto, you like peel off the top layer of the garbage covering your life and the way you feel and your health. And then you kind of are like, oh, I can sort of see there's a thing over here, or there's a thing over there. Why don't I feel good here where I think I should? And so it's like you peel back the layers, and the first layer is your diet. I mean, unless you have a knife protruding from some part of your body or some type of wound, like deal with that first. But really, other than that, it's your diet. But that doesn't mean it stops with your diet.
That's exactly right. And I liken it to the alcoholic. He loves his whiskey and he drinks some beer too. And so the standard American eating the standard American diet is so inflamed, so sick, so miserable that it's kind of like this alcoholic. And so one day he says, I feel like crap. I think I'm going to stop beer for a week and just see if I feel any better. It's not going to help him at all, right? Because he's drinking a fifth of whiskey every day. So when you're eating the stupid American diet, you can't tell what helps and what doesn't help because you're so inflamed, nothing's going to help. But when you go to a diet like keto or carnivore and you remove all the inflammatory offenders, then you can say, okay, this is how I'm supposed to feel. Now let me add back in some dairy and see if that really triggers me, or add back in with this, that, or the other. Right. Yeah. Like Kim Howerton right now in her puffy face. She's still cute as a button, but she's a little puffy. Yeah. But then you can actually listen to your body. But when you're eating the stupid American diet, you can't hear anything your body has to say because all it says every day is, ah.
Right. Yeah. I mean, I don't think there was actually a day pre-keto I didn't have a stomach ache.
Right.
I just had a stomach ache all the time. So it was totally normal to have a stomach ache, and I didn't really think much of it when I had a stomach ache. And then I went keto, but now when I have a stomach ache, I'm like, what is wrong?
What did I do?
This doesn't happen to me anymore.
What did I do?
You're on like high alert now.
And you're able to hear it.
Because you have, exactly. And so that's why people often say, like, why are you talking about these things that don't have to do with keto? But the populations of people we talk, well, you're a doctor, so it would make sense why you're talking about it. But, like populations I see who've gone keto, they're like, I went from like death's door, hating my life, to like really excited to be alive. Now I want it to get even better. So what do I do now?
What's next?
Yeah.
Exactly right.
What's next? Exactly. All right. Did we cover
that's the most common labs that you need to have checked. Now there's a entire secondary level that if your doctor wants to go into even deeper detail, he can check that next level. But the labs we talked about tonight, those are by far the 10 or 12 most common laboratory findings that will mimic clinical depression. And so we're not saying depression is not real. We're saying maybe something else is giving you your symptoms of depression. That's why the antidepressant ain't working, is because you don't really have that. You just have the symptoms of that.
Absolutely. And you might actually have depression issues in addition to these other issues, but until you address these other issues, you'll still won't ever get the kind of relief you want. So it's not like that's a panacea that you fixed your thyroid, but you certainly now are a huge step forward compared to where you were before.
Exactly right. And sometimes, human beings are complicated. right? Some of us are complicated.
Yeah. Who thought?
Right. And so you may have mild clinical depression, and you may have hypothyroidism, and you may have low testosterone. And so for your mild depression, but it seems severe because you have these other things, you're going to wind up on 4 different mood altering medications. And you're like, well, I feel a little better, but it seems like taking all this medicine, I should feel great, but I don't. And that's because you haven't yet addressed the thyroid and the testosterone issue. And it could be any combination of these things. But my point is, if you don't check these things, then you're blind. You don't know. If your doctor doesn't check these labs, your doctor is just as blind and dumb as you are. He doesn't know. He's just literally Russian roulette, throwing a pill at you, and let's see if that helps. I mean, somebody off the street could do that, right? They could just be like, what did I see on TV last night? Cymbalta. Yeah, let's try that. That's literally what your doctor just did if he didn't check these labs.
Yeah, and it's so important. And, you know, Dr. Berry, I know, was talking the other day about this topic because he was so frustrated that he hears these stories over and over again. And, you know, it rang so true with me and my life story about how I was treated at various times. I would like to offer just a little bit of a caution, which is, if you have friends or family with depression issues, please do not go to them and say, you don't actually have depression. Right. You have blah, 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 and have you tried blah, 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 blah. It is insulting. Yeah. So, and it probably will make them put up a wall or a barrier. Yes. Depression is real. It's not a made up condition. It's not that they're not eating the right, you know, necessarily. Now, we are saying those things can cause symptoms that mimic depression. Absolutely. But you must use this knowledge well.
Yes. Gently and lovingly. We're going to somehow bring up in conversation, well, did he check your thyroid and did he check your hormones and stuff? Because, you know, and so you're not going to come as a preacher. You're going to come as a questioner. Like, I just read this article. I was just wondering if you checked your thyroid. See how that's very non-confrontational? Because people tend to own their diagnoses, right? And if you've been diagnosed with depression,
it's an identity at some
that's
point.
Now part of who I am, even though I might not even have that if my doctor didn't check the labs. But now that's part of me. And if you come at me saying you don't have that, you probably got low thyroid, and you come with the wrong attitude, I'm immediately going to be hurt. I'm going to be defensive. I'm going to be like this. And you never change anybody's mind or help anybody if you've made them do that. Right. You're done at that point. You can just shut up. And so there are ways to approach this, but it has to be very diplomatic and very loving because what your goal is to get all their labs checked. And then if they do have true depression, then there you go. But if they don't, then get them treated for what they do have. But you're not the doctor. You're the family member. And so you can't come in guns blazing. That won't go well. I think Kim maybe speaking from experience there.
Well, I mean, you know, a lot of people, very well-meaning people, will be like, when you share with them a very deeply personal and vulnerable reality for you that you have mood disturbance issues, and they suggest perhaps you're not drinking enough celery juice, it can feel insulting. And so whether or not what you're saying actually might be true or be based in a truth they should hear, you have to remember that you're dealing with a person, with a history, with an identity, and you have to work with that, not against it.
Exactly. A person with feelings and a person who has an ego that can be bruised. And so you have to be very gentle with stuff like this. Yeah, absolutely. Yeah. That's awesome, Kim Howardson.
This was fun. We should do it again.
I think we should do this again next week. You want to do it?
What
do you guys think? You want us to do something? We'll do another topic, of course, but we'll do this again next week if you want us to. Just leave it in the comments if you think we should.
Yeah, tell us what you want us to talk about.
And tell us in the comments what topics you'd like for us to cover, and we'll pick the most popular one. How about that?
Or you can say, I never want to see you people again.
Or you can just
I don't think
block
us
both and move on. That's fine.
Move on. All right.
All right, Kim Howardson.
All right, Dr. B. I will see you soon.
Yes, love you. See you next time.
Thank you so much for joining us on Keto Life Support. If you'd like more, You can join our friendly Facebook group, Keto Life Support. Can't find it? Go to ketolifesupport.com. If you ever want to suggest a topic for discussion, that would be the place to do it. We'd really, really appreciate it if you would go to your podcast app and subscribe, because that's awesome. And what would be super awesome is if you'd be so kind as to write a review for us. Though we would love it if that review was awesome, just writing a review is all we ask. So have a fabulous keto week, and we'll see you next time.